Hello, everyone. Good evening. We're taking hospital-based clinical health 1. My name is Agnes Aike. We're going to just go through it in a flash. Within 30 minutes, we should be over. I'm sharing the screen to everybody. Hospital itself is defined. Let me go. As a residential establishment, it provides short-term and long-term medical care consisting of observational, diagnostic, therapeutic, and rehabilitative services for persons suffering or suspected to be suffering from a disease or injury and for pursuant. It may or may not also provide services for ambulatory patients on an outpatient basis. That's according to WHO Expert Committee 1963. So according to that definition, hospital is a residential establishment providing short-term or long-term medical services. And the services are either observation, diagnostic, therapeutic, and rehabilitative. It is an organization and institution of public health for the care and welfare of patients and individuals alike. What are the classifications? It can be classified both on clinical and non-clinical basis. Either on the criteria of the system of treatment followed in a particular hospital, or on the basis of specialization of a particular disease or part of the body, human body. That means a hospital could be clinical, based on the criteria of the treatment that was either given to the individual, or on the basis of the specialization of a particular disease that the individual needed from a particular specialist. On the other hand, the non-clinical method of consultation is based on other general parameters. For instance, the classification can be done based on size, facility offered, ownership of the hospital. Just to wrap this up, we can either say it is based on the size and facility, based on the ownership, based on the system of treatment, and based on the specialization. Where I am is a bit dark. Okay, that's right. More conveniently, hospitals are classified on the basis of the size size and the size of the facility. And in that parameter, you can divide them into according to the bed size, A to C. A less than 20 beds. B between 20 to 100 beds. C above 100 beds. I've mentioned about the hospitals are also classified according to the facilities they offer. And based on that, there are three major categories. The hospital could either be primary, secondary, or tertiary. Primary, as in the primary healthcare sectors. Secondary, as primary could be also be private or public, but depending on the bed size. Secondary could also be from a government or public. I mean public or private, sorry. And depending on the bed size, that's between 20 to 100 beds. An example could be a general hospital when it comes to the public, but private hospitals that have between 20 and 100 beds will go into be categorized into that category. So whereas the tertiary hospitals are large hospitals, highly specialized healthcare institutions with almost all medical facilities available to the patients. Those kind of hospitals don't need, they don't usually refer clients to it, but because most of the needed facilities or services are available within that hospital. Their beds are usually between 100 to 1,000 or more, and they have a lot of specialties in all the healthcare fields. They are good for research, medical propositions as well, new inventions, so experiments, research, procedural experimental research, all that is done in this facility. According to ownership, the hospitals can also be classified in two broad categories: governmental owned or private owned. Governmental owned starts with the local government, medical colleges, general hospitals, state hospitals, federal government hospitals, teaching hospitals, or particular hospitals of corporate, federal governmental corporations like radio hospitals, sport hospital, military hospital. While the private owned hospital is an example is no matter the size, an example is First Consultant, Eco Hospital. Eco Hospital is owned by three resourceful individuals. Could be owned by families, be owned by society or trust, by a mission, could be like churches or religious organization, to be precise. The other sides are usually large enough to attend to the community. Nowadays, all universities are mandated to have a hospital for the students and the population within the hospital or the campus, within the campus. The third one is specialization basis hospital. This can be classified according to the specialized services rendered. There is group one, like the eye hospitals, the dental hospitals, ENT, that's ear, nose, and throat, chest hospitals, and skin hospital. While the group two, psychiatry, like we have a psychiatric hospital, orthopedic hospital, like one at Gobi. Then there's communication and infectious disease hospital. We have an example in Yaba. All this apart, some other apart, there are some other hospitals that offer treatment to fertilized group of patients, like children's hospital, maternity hospital. We have some, both governmental and privately owned. According to organization, the nature and size of the hospital of the organization of the hospital differ according to the requirements. In organization, the structures are given as such, as in the organization of the hospital that manage the hospital. We're talking about the management of the hospital. When we're talking about the organization, we're talking about the management. The structure, this wings is given below. There's a clinical administrator, there's an office administrator, and the departmental heads. All are under a board, a director, and the director is also answerable to a board of directors. Most hospitals have a government council. The government council are also answerable to the board of directors. The board of directors are answerable to the government council. Then the director is answerable to the board of directors, while the unit heads are answerable to the director of the facility. This ensures smooth running of the organization. I've already stated in the organizational structure of the hospital, there are scores of medical and paramedical departments in the hospital. For all practical purposes, both of these departments can be referred to as either medical department or non-medical, or otherwise clinical or not clinical departments. The clinicals are the nurses, the doctors, the scientists, everyone that partake in the care of the patients directly, while the non-clinical are administrative, basically administrative staffs, and the junior staffs like orderly, receptionist, cleaners, maids, everybody that is not part of the medical, that is not taking care of the patient directly. Let me use that word. The list of the medical staff are the dean of superintendent or director of the hospital, the HODs of each unit, the doctors, the nurses, the dentists, the pharmacists, and every other unit that the hospital has. If it is a teaching or medical college hospital, senior doctors teach the medical students during and after the hospital hours, even during the hospital hours. They teach by demonstrating the condition of patients that come to the hospital. The same applies to the nurses. The senior nurses or the nursing tutors teach the student nurses during hospital hours, in the wards, and also in classrooms. So that way they are learning on the go, they are learning on the move. It's not an issue. They are also seeing the cases they read or they learn about in the world. The medical professional attends to patients in the outpatient department. Either start the treatment right away or refer the patient to other hospitalization departments like skin, gynae, if required. They admit the patient in the ward after conducting the required diagnostic tests and history taking and physical examination. If prescriptions are given, and if it is an outpatient or documented in the case sheets of inpatients in the ward, is done after the hours during the ward round. After performing similar tasks are performed in the surgical department. Surgeon performs surgery programs for the day. The patients are then transferred to the post-operative wards. There they are taken care of until they recover. Then they are fit for discharge. Those treating outpatients in the OPD, inpatients in the ward, performing surgery, and other clinical procedures are the routine functions of the medical staff. That apart, they attend to the administrative function of the hospital, and all the important meetings of staff or management. That is for the senior medical staff. The same applies to the nursing staff or scientists, other field. Every unit has their designated functions which they perform dutifully, irrespective of the new tasks that might arise. A surgery might have been programmed for a day, and an emergency surgery emerged that was not planned. That being said, it will not affect the all previously scheduled programs for the day. Time will just be assigned to those tasks, but the emergency tasks at hand had to be sorted out immediately. The next slide. I think I'll explain that my last. There's a question that I added to this. Okay, there's a place above there that says that all the staff members of the hospital work as a team and ensure that the patient is cured as early as possible, and thus the disease is contained and not allowed to spread or damage the person and the society. So that's why the medical profession is called the noble profession by the people, in order to achieve the aim of health for all. Prevention and treatment alone are not sufficient unless the general public is aware and cooperative with the medical system. Current example, or a recent example, was the COVID-19 epidemic. Everyone was involved. The patients, the relatives, the communities, the government, everyone was involved to ensure that it was contained, patients were managed, and the spread was contained. It was prevented from spreading more than necessary. So all the staffs work as a team. So sometimes there will be need for health education campaign to create awareness among people about a disease, preventive methods, nutrition, personal and social hygiene practices, all responsibility via the multi-communication methods like poster, cinema, blog, social media, by the public health authorities. So like I said earlier, I have some questions there for everyone to answer. Try and take time and answer those questions. And then we'll continue from there. Thank you for listening.